If you have a stroke, immediate emergency care can minimize the long-term effects. Then, rehabilitation helps you relearn skills you may have lost. Dr. Adeel Popalzia at Pomona Valley Hospital Medical Center outlines how the severity of the stroke and the medical interventions performed affect the patient's recovery.
Strokes affect people in different ways. So you can have technically a mild stroke and just have some numbness or some mild weakness of the hand, but you can have very devastating effects where you can have complete loss of function on one side or difficulty conversing, talking. So it can be very mild to very severe, actually, to a point to where a patient becomes almost comatose as well. After a stroke happens or when it occurs, you want to see, number one, how severe are the symptoms initially? And then you want to see day by day how that patient gets better. Now it all depends on whether or how they got treated. So if they were treated with certain medications or a procedure to help improve their symptoms, we can see dramatic improvement of those symptoms. You want to wait and see how they respond and how they do, because you can recover from a stroke, you can improve. So that's always important to know, because sometimes patients and people think that that's it, but you can actually improve after a stroke as well.
Getting immediate care is critical to minimize damage to the brain.
The severity of stroke does depend on the acute treatment. So for example, if someone presents within a certain time period, we can give them medications in terms of treatment to help prevent the progression of those symptoms and help to improve the level of disability. And there's also intervention in terms of where we can retrieve a clot to try to help improve their symptoms and to relieve the amount of disability that that patient is facing.
Rehabilitation helps you get back to the life you had.
After an acute stroke happens, the most important thing is actually rehab. Rehab is treatment for the stroke, because there's a way for the brain to somewhat relearn some of these functions that the body has lost in terms of recovering from weakness, numbness, difficulty speaking. So rehab is going to be key in terms of how we treat stroke after the fact.
Dr. Popalzia relates a patient's story and the outcome.
I had a recent patient that was a 65-year-old female. Normally she's highly functional, walking, talking very normally. She came into our hospital with the acute onset of severe disabling left-sided weakness. She could not move her left side. She had difficulty speaking, very slurred with her speech. When she came in, she was about an hour outside of when her symptoms started. So when she came into our hospital, which is a comprehensive stroke center, we were able to intervene right away. So we were able to give her a blood thinner called TPA to help improve her symptoms. And then with more imaging, we were able to detect that there was actually a blockage of blood flow, a large enough blockage of blood flow where we can go in and try to retrieve the clot as well. So with both medications and intervention, we were able to dramatically improve her symptoms. So by the time she was actually done with the medication and the procedure, she was moving her left arm, she was talking normally. So by the time she actually left the hospital, she was able to walk out of the hospital close to her normal baseline. It's always very gratifying to see those outcomes manifest with the interventions and treatments that you do. So when this woman, for example, was able to walk out of the hospital, it was great. We were all very excited. And that's always the goal, especially in the field of neurology and stroke. You always want to reduce the amount of disability for that patient, because in terms of stroke and neurology in general, these patients are facing grave disabilities. So our goal is always to reduce the impact of that disability and ideally get them back to their normal selves. So it's huge. It's amazing to see those types of recoveries.